Let's talk about what dentists don't tell you and popular patient misconceptions. First of all, patients believe that when they have a filling, it's going to last forever. And this is just not right. We know that fillings, and depending on the type of filling material that you use, this will determine how long things are going to last. The better that you brush, floss, diet, mouthwash, then the longer that these fillings will last, and the other way around if you don't do these things. We know that fillings live in a very hostile environment, full of saliva, bacteria, warm temperatures, cold temperatures, and this can lead to breakdown of the fillings as well. Now, for instance, you see a silver filling here. The average lifespan for a silver filling is around about 9 to 10 years. Average means 50%. So after 9 to 10 years, only half these fillings will be left, and the other half will still be there. It is therefore important that you put the best type of filling material in as possible. For instance, if you use a composite filling, which is like a plastic resin, the average lifespan for these type of fillings is only 5 to 6 years. However, if you use porcelain, which is in the lower picture here, you'll see that the fillings will last a lot longer. Porcelain can be known to have a 90% plus survival rate after 10 years, which is sort of following on gold, which is one of the best materials you can put in the mouth. So you have a choice, and make sure your dentist fully discusses it with you before it's all finalised. Make sure you get the best material, and if you do this, then you're much more likely to run into less problems down the road. Recapping that, silver fillings have a life expectancy of 9 to 10 years. The average filling life expectancy for composites or plastic fillings is 5 to 6. Porcelain can last a lot longer and have a 90% survival rate after 10 years. What are the 3 things that lead to filling failure? First of all, chipped teeth, cracked fillings, and decay. We see in this diagram here how bacteria can get in underneath cracks and old fillings, how you can break the filling through here, or if you bite something hard and the tooth's weak, you may break up a big chunk of tooth. Now, what's the big deal? You can go and put another filling in. Well, the big deal is this. Every time you put in a new filling, the whole tooth gets weaker. The weaker the tooth, the greater the chance that you'll need a crown on the tooth. Now, crowns, as you know, are reasonably expensive and could be $1,200, $1,300 up to $2,000, depending on where you go. So it's important that you put the best filling in at the start, and if you do that, you're less likely to run into problems down the road. So what's stopping you from getting these high quality fillings and getting all your fillings replaced with these? Well, in my view, it boils down to 3 different things. One is time, one is pain, and one is cost. Now, time-wise, the more fillings you do at once, the quicker and easier and more efficient it is for you, and the less time you need to spend in the dental chair. For instance, if you did a quadrant each year and you could do it over 4 years. I mean, how much is 1.5 hours out of a whole year? It's nothing. Pain. And we can virtually eliminate pain for most people. So make sure you go and have a look at the video section on this website, and you can look at all that in regards to that. Cost-wise, there is a special section on finance as well. Now, in that, you will find out how you can eliminate a lot of costs. In particular, you may like to look at the care credit side of ones, which show you how you can spread your payments out over up to 48 months. There are conditions apply, and you need to have a look at that, and there's a little calculator so you can work out exactly how much you would be up for over that time frame. There are other very important things on how to manage your costs, such as using a fund, for instance, to get rebates back, such as using the taxation system. Anything that you as a family, not just yourself, but the whole family spend above $1,500 on medical, dental, optical, physio and chiro, the amount of above $1,500 in the one financial year, you can claim a 20% rebate. So make sure you use that to your advantage. I hope all these little tricks and tips have been of help to you, and we'll look forward to seeing you soon in the dental clinic. Catch you soon from the Mildura Dental Group.